Let me know when you're ready. All set? So, good morning, everyone. Unfortunately, Dr. Whalen can't be here today. She had a long night. The pod was successful last night. She was feeling a little under the weather, so she will not be here. But today marks 337 days since this began on March 12th. 11 months today. A milestone I never thought we'd be in. A milestone I did not want to be in. Like everyone else, you know, we're tired, but we got to keep staying strong and we got to get through this. And we owe it to everyone to get through it. Light's at the end of the tunnel. We're almost there. Vaccines getting out. Hopefully we get more vaccine as we go on. We have the demand. We just don't have the supply. But be patient. And the good thing is our numbers are going down. But the sad part is people are still dying, unfortunately, from COVID-19. So there's one new death to report today. A woman in her 80s passed away. To the family, my prayers and condolences go to the family, to all the families. It is a very difficult time to lose anyone in your life, regardless of the situation, but even harder when you can't say goodbye the right way. Though it's gotten better over time to open up a little bit, but it's still tough to send someone off the way you love them. So again, my condolences and love and prayers go to the family. As of today, there's 19,443 cases of COVID-19 in Albany County to date. We have an increase at 85, and I was talking to Dr. Whalen about this, which is good. But again, so it's a big, you know, it's a number, you know, but we are going in the right direction. We're going down. The 5-day average is 84.8. Yesterday it was 88, which is all good news. There's currently 1,805 people under mandatory quarantine. Yesterday it was 1,885. Of the positives, 20 have close contact with positive cases, 5 are healthcare workers, 60 don't have a clear source of infection. As of today, 59,562 people have now completed quarantine, which is good. Out of those, 18,656 were positive and had recovered, which is also good. That's an increase of 144 new recoveries since yesterday. There was 9 new hospitalizations overnight. We have 91 people currently in the hospital, and yesterday that number was 90, so we increased 1. There are 17 patients currently in the ICU. Yesterday there was 16. So please, I know we're getting there. The weather, well, it was a little chilly yesterday. Supposedly it's going to get nicer as we go on, right? We're almost in mid-February. It's going to be a little bit colder, but please remember to wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We're getting through this, but we need to continue to work together in a partnership to get through this, and we need to continue to keep the message out there to get through this. For those who want to get vaccinated, please check your eligibility. That's the key. I did get my personal Facebook, and I will say this. I apologize to the man that showed up from the U.S. Postal Service to get vaccinated and stood in line with his uniform on, but it wasn't his category. He got on, he got through. We apologize. Dr. Whalen and I, we try to continue to let people know who's eligible. We try to put the information out there. Some people get through, unfortunately, and some people don't tell the truth. I'm not saying this person didn't, but some people don't. They try to get through, and then when we ask for that data, the proof that they ask that, how do you fall in, how are you a teacher, do you got an ID, are you police, are you fire? Because our pod, that's all we can do, unfortunately. It's sad when we got to turn away 80-year-olds because we can't do 65 and above. We have strict guidance from the Department of Health, and we can't vary from that. And I wish I could, because there's nothing sadder when you got to look at somebody and say, yeah, I'm glad you got this appointment, but we can't give you that shot, or I could get $1 million fine or lose vaccine going into the future, because that's what's pressured on us every week. So I do want to say, you know, it's tough, but we're in this together. United Way, Pete Gannon, United Way, thank you for what they're doing, but the hotline for getting information, please continue to call. They'll help walk you through it online. They'll get you the numbers. They'll help you with the category, where to set up an appointment. So the availability, 24/7, 365. They're there. So thank you to United Way. Also, I want to remind people we've launched our new pre-registration tool to get people signed up so we can make it easier, less frustrating, and stop the Hunger Games where people got to keep going on every week. Because like I said, our pod filled up in a half hour. Who? I don't know about you. I can't click that quick, and get through it. So, imagine somebody who's just trying to go through it, or a teacher working, or a firefighter working, or a police officer working, and now they got to take a time to sit there and try to pre-register to get on. So it was a huge success. So in the first 24 hours alone, we had over 8,000 people pre-register on the site. I mean, it kind of, So out of that, 6,300 were Albany County residents that pre-registered out of 8,000. Some were duplicates, so we had to go through and figure it out. But good issues to have, good learning issues to have, to sit there and figure this out. I will say this: if you meet that category, you'll get in. We'll text you whatever way they signed up via. They want to be contacted with text, email, or phone call. That's going to happen, and just be patient. You can sit back now, continue to do the right thing. If you're staying at home, stay home. If you go out, wear a mask, socially distance, do the right stuff, and we'll get to you. So when your category hits, or we get approval to do whatever category you fit into, you'll get in. You won't have to call again. You won't have to keep monitoring. Just look for your right time, and it might take a couple weeks. It might take 2-3 weeks. Might be next week for some of them. But I can tell you that 8,000 people, we only get 800. So I think last night we did 800 vaccines, 400. On top of that were people for their second shot, and another 200 on top of that. It was a huge success. But again, so that's the amount of vaccine we're getting in. So again, you got to be patient, but we will get to you. So it was a good tool to stop a lot of people's high blood pressure from going up and being nervous about getting in there. So, we know the virus has taken a larger toll on our minority communities as well as our older residents, many with underlying health issues, which opens up this week. We're still waiting on the guidance from the Department of Health. It's kind of changed. I was on a phone call. I can't remember now. Anyway, I was on a phone call this week because I've been on so many of them. And they talked about what are going to be the requirements. They have to bring a doctor's note in. Can they just come in and say they have an underlying health issue? Is cancer going to outweigh obesity? Is obesity going to outweigh high blood pressure? And so on and so forth. And Becky Murray from St. Peter's Partners, thank you. They got over 40,000 patients they're going to be reaching out to, and they want to get the right guidance to the people what they need. What we're being told is nothing's outweighing anyone. If you've got obesity or cancer, it's going to be treated the same. Problem is, it causes a problem. We don't know how many vaccines we're going to get for next week to do this. We don't know how many they're going to set aside. So we usually don't find out the earliest, I think, because I'm usually up, Saturday at 1 o'clock in the morning, we get our first email from the Larry Sports to tell us that what our vaccine is going to be for the week, no later than Sunday by 1 o'clock within that 24-hour window. So, and then we got it properly planned from there. That's why our website really didn't go up till like Tuesday, because then you got to figure out how that category fits. So people are going to have to be patient. It doesn't mean because they're doing underlying health conditions, which I'm happy about and helped make happen. They might only say we only got 200 vaccines or 50 for the week, So, and that's going to be hard, because how do you decide, So the pre-registration is going to help. But it looks like right now, and I know Dr. Whalen's team, Mary Beth Miller and all them, and I can't thank their epi department, everyone down in that department. I was working on guidelines, but it looks like you just need to come in and be honest. And I have an issue with that, because unfortunately some people won't be honest. Some people have gotten shots that shouldn't have gotten shots. Some people have lied. And again, I've said this, and speaking from my heart, what we did and more, we got to live with a year later. What we did, our actions, we have to live with. My actions for the last 11 months, I have to live with the rest of my life. And it might not bother you now, and some people it will never bother. But time from now, you're going to sit back saying, why did I not wait my turn? And why didn't I wait to go? That's why I chose early on to wait. To say, hey, look, let's get it where it's affecting the most population the most right now. And that was the seniors. 94% have died from this. And, that's the ones that should have got vaccinated first and foremost. So please be patient. Let people get there. If you're continuing to do the right thing, stay home. Let's get the shots in the people's arms that need it. But I just want to put a few statistics out there. Back on May 17th of last year, men accounted for 53% of all people dying at that time. Women accounted for 47%. Fast forward to now, men account for 45% 45.7 to be exact, of all deaths, and women account for 54.3%. So it's flipped since the springtime for whatever reason. We're also seeing the terms of infections, which I'll show you in the COVID dashboard behind me in a second. Disparity among men and women becomes more concerning when you consider this, the survey that shows women are more likely less to get the vaccine than men for whatever reason. One of the articles I can refer to is the National Geographic survey. Even showed women were less likely than men to get vaccinated by a difference of 19%. There's another obstacle we need to overcome to show women that the vaccine is safe and effective in order for us to, to get to the immunity. People that are pregnant, please, check with your doctors. I know when women have come through our pod that are eligible, the doctor sits with them, talks to them, tells them it has not been studied through the trials. They don't know, and that they should confer with their own doctors if they feel safe enough to get it. I'm not saying yes, or I'm not saying no. That's between you, your doctor, and your decision with you, your husband, your spouse, or your lover, what you want to do. I don't know. I don't know enough about it, and the doctors have said the same thing at our pods, that it's totally between you and your doctor. They'll give it to you if you feel safe, but it was not studied. So, again, that's something you have to work out. On the other hand, one thing that hasn't changed much through this is the number of infections among age groups. People in their 20s, which I identified early on, continue to have by far the highest number of positives. Now is well over 4,000 people. But more recently, another age group has had a larger increase in the number of positives. For some examples, since January 19th of this year, people in their 20s account for 19.3% of increase. People in the age group 10 through 19 years old have increased 21%. People in their 40s, 22.4%, and those in their 30s, 22.6%. So I'm going to go to the smart board, which I normally would put my mask on, but Dr. Whalen's not here, so I will go up by myself. So if you look at our dashboard and you're going forward, it shows you, where we were going into May, and it started to climb back up, and now we're going down into the other direction. The same thing here, if you go back before May, we're going up, you go down, and then how we had the huge spike, and now we're starting to come back down, which is all good. That means people are doing the right thing, and we're starting to get through this. The age groups is what I continue to talk about. You can either look at the 0 through 9, that age group is going up, the 10 through the 19, and then you can just see the continue. The 20 to 29-year-olds are the ones that I've been talking about since the beginning. I started watching that since day one, steadily take over, because you got to remember the 30 to 39-year-olds was the bigger category. Now look at the difference between the two. I mean, it's just the 20 to 29-year-olds have just taken off for some reason. And then you're starting to see where the 30, 39s, but you're seeing the 50 to 59s steadily start coming up too, for whatever reason, and which is alarming. But if you look at the chart also, and that's why I was hoping Dr. Whalen was going to be here to get into this side of it, but 52% female, 46% male that have total positive COVID-19 cases, and it breaks it down into different groups. And the other thing that we've been watching too is the Asian population. For some reason, we're seeing more numbers of people in ICU, and unfortunately more people in their 50s in that category that's passing away from this. And again, it's no rhyme or reason. We just try to figure it out, and males and females. But again, there was 456,000 people. That means people who got different tests throughout the time, and I think Albany counts. It was a great question that people keep inquiring. The best I can tell you is this, is that a lot of people have got tested, and the drive-through probably counts for us, and that's why you see 456,000, because our population basically is between 310,000 and 320 in Albany County. I'm hoping for 320 at the end of the census, again, yeah, so that would mean everyone in Albany County got tested, but that's not factual. It's just the people that are in healthcare and other things. So I just want to remind people, we can't. It's not time to get lazy. It's not time to get COVID-19 fatigue. I can assure you, after 11 months, we're all tired. I'm tired. I know Dr. Whalen's tired. It's hard because it's changed. And if you think what we were dealing with in the beginning, they talked about no mask. Mask wasn't even mentioned. Then they say wear a mask. And if I forgot, because I was talking to somebody, I'm like, because you think about the stuff we put out in the beginning, CDC put out, and as you learned, as it evolved, and as we got smarter with it, you know, we stopped using grocery bags because they said you could carry the infection, so we went back to paper bags in supermarkets. You had to wipe down surfaces because you could get it off the surface, and that's all changed over time. And again, as you see, as we learn and science has gone through the data, and as they go science, not people's opinion, science goes through the data, and the health experts continue to watch us, or this evolves, things have changed. And it's kind of funny, the things we were dealing, not funny, but the things we were dealing with in the beginning, and how it's really changed over time, and some of the things we thought you had to do, you don't have to do. We talked about Merc 13, air handlers, filters, and you got to change all that out, and it's just a variety of things. So it's like, hey, look, stay patient. We're going to get through this, but we have to stay strong. And the only way we're going to get through this is if people continue to do the right thing. I sure as heck don't want to go back, and I know no one wants to shut down again. They keep talking about March. I'm not even going to go on that. Let's just stay positive and stay, positive with the message. But educate yourself. This keeps morphing and changing, and we need just to be ready, and we need to understand this. We've come a long way in 11 months. We really have, and we had to reimagine everything. And to the people that are struggling, my heart bleeds for you, and I know it's tough. But we're going to get through it, and we'll continue to get through it, but we have to stay strong. So I do want to say thank you to all the volunteers who make the medical corps up at the Times Union Center. It's an impressive operation. I'd say the media should come down to one of the events and check it out. It's run smooth. People are in and out within usually a half hour, which is amazing, to the whole team. And it's a lot of volunteers, too, that the runners, the people on the floor, the behind the staff, it takes a lot to set it up when you're doing almost 1,600 vaccines in one night, in one day, I should say. I think they open from 1 to 7. But it's a lot of logistics, and I do want to thank the Department of Health and all the volunteers that make this possible, so thank you. I also want to commend Dr. Whalen for receiving the 4 Chaplains Award. It's a military award, about 4 chaplains that went down with the ship, and they gave up their life jackets on a sinking ship to save other people's lives. So it was an honor for her. It was an honor for me because I go to this every year as a military person, and I got to do a little video for her. To her and Mary Beth Miller at Department of Health, and all the people at the Department of Health, and all the healthcare workers, because this was about all the healthcare workers that are on the front line dealing with this. Thank you to the essential frontline workers, especially in our nursing homes and our ERs and our hospitals. So thank you, and to Dr. Whalen and her department, thank you for your professionalism and service to the county. But I do want to say thank you to all of them. So I want to tell people, we encourage you to continue to get tested, whether you have symptoms or not. That helps us, to know where it's at for epi, for mapping and tracing. Let's not forget about that. I think we all learned about that early on in the beginning of this. So Whitney Young, as always, great partner. You can call them always at 518-465-4771. We cover the cost if you don't have insurance. And then the University of Albany is free. The Governor Cuomo set that up throughout the state. You don't need health. Even if you have health care, you don't have to pay. 1-888-364-3065. Always albanycounty.com to see where if you're eligible, what you're looking for, and times to wait to get tested. Our mental health, Dr. G was on yesterday, and please, anyone that needs it, call. I know it's a different world, and don't be ashamed to call and just ask a stupid question. It's all right. You know what a stupid question is? One not asked. Seriously. So, I mean, it could be something that just bothers you. That's all right. Someone will be there to help you. Please call the number to 518-269-6634. You think I know these numbers by heart by now. And our 24-hour sexual assault hotline to that team for all the work that you do. Thank you. 518-447-7716, our 211, and the New York State hotline number, as always. And we'll get through this, working together. Any questions?
So on Monday, people with pre-existing health conditions can start getting the vaccine. Is there a definitive answer, or do you have an idea as to why the county once again is being overlooked when it comes to now the pharmacies being able to give the vaccine?
Listen, I could sit here and give you 50 different answers, to be quite honest with you. I just have to adapt and change to the rules. They've trained for this. We're used to doing this. Whatever reason Department of Health decided to change it up and go through hospitals and this and that, it helps, but this is what we trained for 30 years. We know what we're doing. Dr. Whalen and her team do a phenomenal job. My only concern is just educating people and getting shots in arms. And if we have to use multiple partners, that's fine. But we have to communicate. And that's what I was saying yesterday, that when we found out that the College of Pharmacy had vaccines and they were just going out and giving shots and not talking to anyone. It's duplication of work, and it really helps if we're all on the same shitty music, because it's about serving the people. Anyone else?
So we got bad news on Tuesday and good news on Wednesday. The bad news on Tuesday was about the NAL pushing the season for the Empire back to late May. The good news being from the governor saying that arenas can open later this month with a 10% capacity. We have one of those here in the city of Albany. So your reaction to the fact that 1,750 people, I think, can now attend whatever event at the Times Union Center as of the 23rd?
Financially, it doesn't work. It won't work. According to Bob Belber, that's why we have AMS that does this for us. They need at least 25% to make it work logistically to bring people in. So, I mean, that's something that they have to look at. That's up to them. I mean, Sienna's basketball, when they usually play, typically get between 4,000 and 6,000, if not more, sometimes up to 10,000 fans. So it makes it hard, So a lot of these acts that I want to announce this concert, but I can't. They're not going to come at 10%. They will come at 25%. And then you look at the Palace Theater, which roughly has, don't hold me to this, I think 2,000 seats maybe. How's that work? You play for 500 people. It's a good intention. I get, open it up, let's get going. But it has to make financial sense. It's not like Buffalo Stadium that was so big. And let's face it, it was playoffs, so there was a lot of other money involved with TV rates and everything else. So.
Also, on that issue, do you all still have the regional control room calls frequently? And if so, has this been brought up? And did you guys hear about this the same time we did? Because that seems to be a recurring theme when there's news, is no one who should be in the know is briefed, and everyone finds out at the same time.
Next question.
Okay. And as far as the acts that are not going to be here, how many of them are canceling because you can't have 25%?
I know Bob is working it out with them. It's great questions you're bringing up, and we're trying to work with them to make it feasible for them to come, to open up. They have a great lineup of concerts, I think, at the end of March and May and June. We have some other great announcements to make about the arena. But it has to make financial sense to open up and do it safely, because there's you got to figure there's a financial impact to make sure people are being tested, to make sure people are wearing their masks, making sure we're taking, it's about the safety and health of the fans and the people in the sports or concert, that we have to put into that. And there's a cost to it. There's a financial cost, and then there's a financial cost for them to come here to play. So, it has to make sense at the end of the day.
That actually sort of led into the next question, which is the state at all going to come in? And the rapid testing, we don't really have a figure from the state on what that's going to cost per test or per event. Is that a county burden? Is that the promoter's burden? Is the state going to pay for that?
That's the same thing. I know that Dr. Whalen's doing, just not to jump in, kind of falls into weddings of 150,000 people, because I keep getting this question from restaurant openers, people that have this type of place. I was talking to, and I don't want to throw him in, the guy from Normanside, Dave, that said, I'm just not going to open up to October. What do? Book a wedding, and then they show up that day and they get a rapid test, and then the groom or bride's positive and say you can't get married now, or you can't have your reception. So I don't know how that's going to work. I don't know. He asked the same questions. I go, is it the Department of Health that has to come and do that? I don't know. And logistically, it'd be a nightmare for me to have to go to every restaurant or venue in the county to do rapid testing, and then you got to send it out. So yeah, or not send it out, but you have the machines, and the machine's going to be reliable, that type of stuff. So.
Last one, 23rd is when you're allowed to have things back at the TU Center and various venues, but are you all planning to start bringing things back later this month, or is it something down the road once we know how you can actually do that financially?
It's a little bit of both, but I'm watching the science, right? And I said this even when I got into the debate, and I don't want to keep going down this road with the sports, right? It has to make sense. To me, it's not about, I said this 11 months ago. I got to worry about the finances of the county. I got to worry about money being spent. I got to make sure I can't tax my way out of this. But the bottom line is it's about the safety and health of the residents. So I can assure you I don't want to do anything if it's not safe. If these numbers continue going the right direction, we continue to get more vaccine, people continue to get more shots, yeah, we'll start opening up more. I kept saying September, October. I'm hoping now if the vaccine starts coming in, you're talking summertime when we can really start getting back. And if we can safely do this, and Bob has to convince me we can safely do this with 25%, we will. We will continue to move in that direction.
What is your reaction to the news that came out last night from the New York Post, a Cuomo aide admitting they hid nursing home data?
So I'll tell you my motto, and there's a lot to get into that other stuff. When the eagles are silent, the parrots begin to jabber. Winston Churchill. That's all.
Will this change your working relationship with the Cuomo administration during the pandemic?
One of the things that when we had our first resident die April 16th, I had a conscious decision, and that's why I read the Winston Churchill thing to you, that I could either not report the first 7, I think it was under the state DOH guidelines, learned from being in war, learned in just history, politics, or anything else. It eventually comes out. Might not be today, might not be tomorrow, could be a year from now. But I want to be transparent, and that's why I said I live by Winston Churchill's little phrase there, if you read into it, and decided to say the first one, and the second one, and the third one. And then if you remember, I think it was like end of May, that we had over 24 people report it through the system that wasn't reported, and I had to report it. And I subconsciously decided I'm going to read it out, because people have the right to know. So when you're going through a health crisis and you're trying to lead, you have to lead, and your people around you have to understand where you're going, because if that message and that gets into the Winston Churchill quote, if that's a disconnect, it's not going to work. So I chose to go one path. That's all I can only speak for what I did in my administration. I can't speak what other people have done in reasonings. But I've said this, things change. What we were dealing with back then and the data that was in front of us from the CDC, that probably was the right decision, whatever they made. And, when you have the Java Center open up, you have the ship-in to take patients. You set up a mid-shift hospital on a pier for $2.8 million. No patients at any of them. But what you were dealing with was a problem that we've never dealt with. So to me, I can understand, but you have to be transparent and tell people this is why we did this. But I don't know the whole logistics, so I don't want to get into it. I can just tell you how I dealt with what I was dealing with.
I was going to say, did you notice discrepancies between the numbers that you were reporting versus what you were hearing from them? And at any point, did you feel lied to or that they were underreporting?
We had our issues with the Department of Health. I don't know where the guidance came from there. I don't want to say it was the governor's office. I don't want to say it wasn't the Department of Health. I said with the dashboard, I think everyone did. The data wasn't matching up what we were getting or we were finding out. I only control Albany, Shaker Place, Rehabilitation Center. That's it. All the other nursing homes in Albany County are either they're all privately run besides ours. They don't fall under us. They either fall under the Department of Health, state Department of Health, and they weren't telling us when people were passing away. So for us, it made our job harder to try to do the logistics of saying how bad is the spread in nursing homes, how bad, because it's easier, that's why you do the EPI, the mapping and tracing. So if you know you have an outbreak, you can get in there quicker, you can address the issue, you stop the spread. That's why you have the EPI department. But you can't do that when you're not getting the data, and I think everyone knows the arguments and debates and fights we had. It does feel like it was a year ago, it has been almost a year, but we got through it, and we started to get better numbers. And I can only lead with the information that's given to me.
Just one quick question about the vaccine allocation. Week to week, are the numbers vastly different in terms of what you're getting, or do you have an idea? Maybe 500 one week, 400 another week, or is it like 100 one week, 500 another week?
So in the beginning, it was kind of like that. So we've been fortunate enough, we've been getting 800 every week consistently. And then we got 400 on top of that for the reshots, and then they gave us an extra 200 on top of that to do a certain group that they identified at the Department of Health and asked if we could do. But I've watched other counties. I watched Steve McLaughlin one week at 100, 100, 100, and then a week later he gets 2,300, and then he gets 100 again. It's hard because like I said, there's a lot of logistics. So I do stay up late at night, and I'm waiting for that email to come in from Larry Schwartz at 1 o'clock in the morning, because there's a lot of work that has to go in. Because are you doing a pod for 800? Or are you doing a pod for 100? Because you got to contact everyone. And I know a lot of it's just because they're waiting on the supply from the CDC. They find out Thursday, I think, when how much supply New York State's getting, and then they got to allocate it. So it takes time on their end. And then they have to figure out where it's going, and then we have to figure out. I wish we had a consistent number because of planning, but we've been fortunate compared to other places that I've seen the numbers go up and down. Anyone else? Thank you, everyone. Stay safe out there.